According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. It leads to a socially and economically productive life. Community is defined as a sociological group in a large place sharing one environment. It therefore includes the individual and the family. Community health is defined as the art and science of maintaining, protecting, and improving the health of all members of the community through organized and sustained community efforts. According to the World Health Organization, the characteristics of a healthy community include a clean and safe physical environment, an environment that meets everyone's basic needs like water, food, shelter, and clothing, an environment that promotes social harmony and actively involves everyone, an understanding of local health and environment issues, a community that participates in identifying local solutions of local problems, a community whose members have access to varied experiences, means of interaction, and communication, accessible and appropriate health services and facilities, the promotion and celebration of historical and cultural heritage, a diverse and innovative economy, a sustainable use of available resources for all, primary health care. Our government believes that a strong nation needs healthy citizenry. In order to achieve this, the Department of Health promoted community health with a partnership of community, barangay, government, and non-government organizations through the program called Primary Health Care. The primary healthcare program in the community. Health center services and their functions. One is the maternal health care that gives prenatal, natal, and postnatal services. Number two is the child health care that gives immunizations and the control of diarrheal diseases. Number three is the nutrition program that has an operation timbang and food supplementation. Number four is the population and family planning program that gives free family planning. 5. Control of communicable diseases, which has the tuberculosis control program. The inspection of food establishments, which is under number 6, the environmental sanitation program. Number 7, the control of non-communicable diseases, which provides blood pressure screening. 8, the dental health program that provides tooth extraction. And number 9, reproductive health care, which provides counseling on family planning and reproductive health. And number 10, medical morbidity clinic, which provides the provision of free medicines. Bloodletting activities at barangay level, which is under number 11, National Voluntary Blood Services. Number 12, epidemiology and surveillance program, which controls outbreaks like dengue. Number 13, Disaster Management Preparedness Program, which provides medical services and assistance during disaster. And 14, Mental Hygiene, which provides adolescent counseling centers. And number 15, the pharmacy services, which is in charge of the distribution of medicines to all health centers. Perennial community health problems. One of the community health problems is human excreta and sewage. Next is human disposal. Another one is the control of disease and food sanitation. Peace and order is also one of the problems. Another problem is water supply and the prevention of drug abuse and control in the community. They vary according to factors like economy, politics, geography, culture, and social context. There are places which experience community health problems like waterborne and communicable diseases, armed conflicts, natural disasters, highly urbanized zones, and overpopulated areas. In this regard, the government has created an office which would be in charge of planning and implementing rules and regulations to address the community health problems. One of its programs is Solid Waste Management Program that helps lessen the amount of refuse in our country. Kinds of refuse, composition, and its sources. Garbage are wastes from preparation, cooking, and serving of food, wastes from market, and wastes from handling, storage, and sale of produce. Sources are households, restaurants, institutions, stores, and markets. Rubbish. The composition has been classified into two, combustible and non-combustible. Combustible consists of paper, cartons, barrels, wood, excelsior, tree branches, yard trimmings, wood furniture, beddings, dunnage. Non-combustible comprises of metals, tin cans, metal furniture, dirt, glass, crockery, and minerals. The sources are from households, restaurants, institutions, stores, and markets. Ashes are residues from fires used for cooking and heating and from on-site incineration. The sources are households, restaurants, institutions, stores, and markets. Street refuse are sweepings dirt, leaves, catch basin dirt, contents of litter receptacles. The sources are from street sidewalks, from alleys, and vacant lots. Dead animals are dead cats, dogs, horses, cows, and other animals, which can be found in the street sidewalks, alleys, also, and vacant lots. Abandoned vehicle are those unwanted cars and trucks that can be found on street sidewalks, alleys, vacant lots. Industrial wastes are from factories and power plants, the composition of which are the food processing wastes, boiler house cinders, lumber scraps, metal scraps, shavings. Demolition wastes are lumbers, pipes, bricks, masonry, and other construction materials from raised buildings and other structures. They are coming from demolition sites to be used for new buildings or renewal projects or expressways. Construction wastes are scrap lumbers, pipes, other construction materials. The sources are new construction and remodeling. Special wastes are hazardous solids and liquids, explosives, pathological wastes, radioactive materials, batteries. Sources are households, hotels, hospitals, institutions, stores, industry, and sewage treatment residue. The compositions are solids from coarse screening and from grit chambers. Also septic tank, sludge. Sources are sewage treatment plants, septic tanks. Here's more for your memory bank. Garbage refers to leftover vegetables, animal, fish, and other food materials from the kitchen and establishments. Rubbish are waste materials such as bottles, broken glass, tin cans, waste papers, discarded porcelain wares, pieces of metal, and other wrapping materials. Dead animals are lifeless dogs, cats, rats, pigs, chicken, and other animals which die from diseases or accidents. Now, stable manure includes the animals' wastes from barns, stables of the like. Street night soil consists of human waste, normally wrapped and thrown into sidewalks and streets. It also includes human waste from the pail system. Yard cuttings are those leaves, branches, grass, and other similar materials made during cleaning of gardens and typhoon aftermaths. Solid waste management refers to the discipline associated with the control of generation, 2. Storage collection, 3. Transfer and transport, 4. Processing, and number 5. Disposal of solid waste.